morning and welcome to Health Talk, sponsored by Mon General Hospital. This program is designed to provide education on vital health topics to help you take charge of your health. You'll also be introduced to Mon General's committed physicians, allied healthcare professionals, and quality programs and services. And now, here are your Health Talk hosts, Kay Murray and Jim Stallings.
Today's topic on Health Talk is lymphedema. What is it? We're going to find out in just a moment with Erin Double. She's back for another round of conversation and education about lymphedema. I'm Jim Stallings along with Kay Murray. Good morning, Kay.
Good morning, Jim.
Welcome back, Erin.
Thank you. Good morning.
Let's talk about lymphedema. First of all, what is it?
Lymphedema is an abnormal accumulation of protein-rich fluid in the body. So it can be found in an arm, a leg, your head or neck, and you'll notice it if you have a lot of swelling that doesn't go away.
So it's a protein-rich fluid, which in itself sounds, hey, that's all right. We need protein, but I guess we don't need lymphedema.
Correct.
All right, so what kind of fluid is this?
It is, like I said, it's a protein-rich fluid. So in the body, you have protein, but for some reason, the lymphatic system cannot get rid of that protein. So it sits in the body, and the protein collects water, which makes fluid, and you can't get rid of it.
So other than swelling, is it bad for us to live with like this, to live with lymphedema?
It is. If you don't get rid of it, the tissue can become very hard, and then your blood can't flow through because the tissue is hard. So we have some ways that can help manage the lymphedema so it doesn't get worse and become hard. With the skin being hard, you're prone to infection. Also cellulitis, which is a skin infection, and if that gets serious enough, you can possibly die from it. So.
And by the way, Erin is a certified lymphedema therapist.
Correct.
And so we come to you. What are we coming to you for? What are we feeling? How do we know something's wrong?
You're coming to me if you have it's usually one body part that's affected. So if you have a leg that's a lot bigger than the other, if you're standing on it and it's feeling heavy or achy or tired and you can't get the fluid out, if you're having a hard time fitting in your pant leg, or if your watch is really tight on it or your shirt sleeve won't fit, then you would come to me.
Sounds a lot like something you'd feel if you had a blood clot, too. I mean, you're swelling in certain parts of your body like that.
Right. If you would want to go to the doctor right away to make sure you don't have a blood clot.
But wouldn't a blood clot be in the vein, whereas lymphedema is in the tissue around?
Correct.
Yeah, I guess what I was focusing on the fact that that's swelling in the leg at one spot or in the arm, you really need to get to a doctor because you don't know what's going on. Right. And how do I get lymphedema? There
are two ways that they've found that you can get lymphedema. It's either a primary, which means you're born with it, and there's nothing you can do to stop it from coming on, or you can acquire it if you've had a cancer, where you've had surgery or trauma or radiation in your lymphatic system.
All right. I want to ask you about that lymphatic system because lymphedema is LYMPH, and so we have lymph nodes, we have a lymphatic system. A lot of us hear or think about our lymph nodes as being on our neck, behind our ear, but they're all over the body.
Correct. See, I think of breast cancer or something like that with a woman.
Right. You can get lymphedema if you've had a mastectomy and they've had to take as little as one lymph node. It can affect the whole lymphatic system, and you can develop lymphedema.
So is it the job of these lymph nodes to have this protein fluid go through them and filter them out and make them usable for the body?
Correct. It's sort of the lymphatic system is sort of like a vacuum cleaner. It sort of sucks up all the dirty stuff in our body and filters it out.
So if there's hundreds of lymph nodes, you're saying if you mess with one of them, it could mess up the whole system. There must be a perfect balance right there.
Correct.
You talk about the tightness and the swelling. Am I going to be in pain at all with it?
You shouldn't be. There are different types of things that we can help with if you are having pain, but if it's lymphedema, it should not be painful.
So our skin's going to get hard and crusty. Okay, what are we going to do about it?
Then you're going to come to me. You're going to see the doctor, and he's going to make sure you don't have any blood clots or that your kidneys and your heart can handle the extra fluid return. And then what we're going to do is we're going to massage you in a special way to kind of clear out the lymph nodes so they can get the extra fluid and filter it out. And then we're going to wrap you with certain special wraps, and you're going to stay in wraps for a while. And then after that, we're going to get you into a garment that you'll wear for the duration.
How do I go forward with life with that?
Then you just the wrap or the garment part of your routine. So you get up in the morning and you put it on like a pair of pantyhose and you wear it, or your sleeve for your arm, and you can wear it in the swimming pool. You can wear it.
Is this going to be for the rest of my life?
Yes, it's a lifelong condition that you have to manage.
But the good news is, I think I'm going to ask you, if you have it in the arm, that means you're not going to get it in the legs, because you said one body part.
Right. You have lymph nodes in your neck, in your armpits, in your belly, and in your groin. And so whichever part is damaged, that's where you're most likely going to get the edema.
So that's good news. If you have it in your arm, you're not going to get it in your legs.
Yes, correct.
Okay, so if you have to wear a compression, is it a compression stocking you're talking about? If you have to wear one on your arm, you won't have to wear a whole body wrap or anything like that.
Right.
So you can do anything. Are they beige or flesh colored if you're Caucasian, and do they have dark ones for people who are non-Caucasian?
Yes, they can match your skin tone. But then you have they have little tattoo sleeves that you can go on top, so you can have decorative.
Really?
Yes.
It's like an iPhone case for your arm or legs.
Your own personality can show through with this. Absolutely. So there's no magic pill.
No magic pill. Nope. Oftentimes doctors will prescribe a diuretic, but it doesn't really help because the diuretic takes away the fluid, and you're not taking away the protein, which is attracting the extra fluid.
Does there come a time where you may have to go through surgery?
They are currently developing microvascular surgeries, but at the current time, surgery is really not a cure.
Is this real common?
About 1% of the American population has it.
Is there any, and Jim talked about race, is there any particular race that is more affected than another?
Not that we've found so far.
Sex, female, male?
Smokers?
More female than male at the current moment because of the breast cancer. That's the number one cause.
Of course, more women. 304-296-0041. If you have a question or a comment, if you know someone that's going through this and you want to talk about it on the air, we're all learning. Give us a call. We'll be right back.
The doctors, the latest news and procedures. Your local health connection is Mon General's Health Talk. If you'd like to be on the show, call 304-296-0041.
Occupational therapist and certified lymphedema therapist and occasional cougher, Erin Double.
Sorry.
I already had your
It's
mic
live
on, but
radio.
that's
It's live
okay. I
radio.
should have turned off your mic had I suspected you were going to cough, but
I'm sorry.
that's okay. A lymphedema therapist. You're going to make us all better if we have lymphedema. At least get back to normal life. Anyway.
I don't want it.
No, you don't want it.
No, I think it's really something like this that you have to go for the rest of your life with, and there's no cure. Do you think we will ever have a cure? Are there studies being done? Are they researching this?
They are, and hopefully they will find a cure for it. But right now they don't know what's really causing it, why the lymphatics all of a sudden don't work, and you get the extra accumulation of fluid. So
You mentioned that we could be born with this. Is this something that hits us at a certain age, or can children also be affected by lymphedema?
yes, children can be affected. You can notice that one leg or arm is swollen, and oftentimes they won't know really what's wrong with the child. And then as they start walking, their leg can become more dematous and continue out. And I was talking with a lady the other day who that happened to her, and she was, went throughout her life, and then they just discovered that it was lymphedema.
Let's narrow it down into different stages. I understand we'll go through like 4 different stages. So let's start off with the swelling, as you talked about. And that would be one of the first stages.
The first stage is actually you're not going to know you have it. It's kind of in your body, but it's not really present, or you're not going to know that you have the extra fluid. The next stage is that you have the fluid, but when you kick your leg up or you hold your arm on a pillow, that the fluid kind of goes out. And then the second stage is you still have the fluid, but when you elevate your leg or your arm, the fluid is not going to go away. And then the more fluid that sits in there, your skin can become hard and crusty, and you'll start to notice the skin changes. And then the third stage is what everybody most commonly associates lymphedema with, is the elephantiasis, so the leg or the arm that's gigantic.
Can this get infected in any way? Could it be life-threatening?
Yes. If your skin becomes hard and dry, it can crack, and you can get a skin infection, which is the cellulitis. And with the bandages, and the compression garments, they are always pushing on the skin, which can push that infection right up to your heart and become life-threatening very quickly. So that's one of the key pieces, is educating the patient on when to know when they need to get to the hospital to prevent the infection from spreading.
So the bandaging is going to keep us from swelling. Is that the purpose of putting the bandaging on?
Correct. You're going to wrap the arm or the leg in special wraps. So you get a wrap to protect the skin, and then a wrap for padding, another wrap for padding, and then wraps with short stretch bandages that will actually, when your arm or leg moves, it pushes against the muscle or the skin, which actually moves the fluid
So we're
backwards.
pushing the fluid out. Is that
Correct, up towards the heart and the kidneys, and it filters out.
And that's why we don't want to get any type of an infection
Right.
in that area. And you're saying this is something we'll have to do for the rest of our life. Is this something that these bandages, you will teach us how to take care of ourselves, or is this something we need to come to you for every time, Erin?
No, I will teach you how to wrap yourself, or if you can't wrap, I will teach your family member or friend how to wrap you. And you only really need to be wrapped in the beginning stages, and then you will go into the bandage. Now, if the bandage is holding you for a while and then all of a sudden you're starting to swell again, then you can wrap at night. The bandaging is really the most effective portion of the treatment, but because they're so bulky, nobody really wants to wear them for the rest of their life, which is why the garments were created.
Yeah, and we have to take a break, but before we do that, I would think that if you're going to be wearing these bandages all the time, your skin's going to get dry and cracky. And do we have any kind of a cream that you recommend, or something that we have a prescription for?
Yes, you can get a cream with a low pH that you can put on right after the shower.
Now, are there any people out there that are not candidates for immediate therapy?
Yes, anybody with an acute affection, a blood clot, any sort of heart or kidney problems, or an active cancer, you have to be cleared by your doctor before you can receive treatment.
So what kind of kidney problems would exclude you from getting treatment for lymphedema?
Any kidney problems.
I guess we know if we have kidney problems, but I mean, some people
Right.
have kidney stones. And
Oh, no. If your kidneys are not working properly to filter out the fluid. So that would be determined by your doctor.
Erin Double is our guest this morning, and she's an occupational therapist and certified lymphedema therapist. And phone lines are open at 304-296-0041.
This is Mon General's Health Talk, providing the information you need to take charge of your health. Call us now with your health-related questions at 304-296-0041.
Occupational therapist Erin Double joins us on Health Talk, brought to you by Mon General Hospital. Talking about lymphedema today. That's what you call it. I hear most people call it elephantitis. Did you hear about George? Yeah, he's got elephantitis. No kidding. Where? On his arm. But, you know, we've seen some people, I think, that have one arm larger than the other, and perhaps they have lymphedema.
Correct.
So we're talking about that today and the treatment for it. And it's a protein-rich fluid that stays where it's not supposed to.
Yes.
Because it's not being filtered by the lymphatic system.
Yes. You got
Wait,
it.
that's very good. He could be a therapist.
Good.
Well, you know, we have a
Almost.
lot of filters in the body, and I was thinking of an analogy in the last segment when you were talking about that, and I think that, you know, a gasoline filter on your car gets clogged up and doesn't let the gas get to the carburetor, and then your car starts sputtering a little bit. I guess that's what the lymphatic system is, and even the liver is a filter in itself, but we have all these ways to cleanse our fluids in our body. It's amazing to me.
See, it's really interesting the way he thought about that, and I thought about a filter on his mouth at times. That's just the way I thought about it, putting a filter.
I'm not sure there is such a thing.
You're probably right. This is a disease.
Correct.
And we talked about that in the break. Do we end up going to Mon General's Wound Healing Center, where we always come to you as a therapist? What's the prognosis, and where do we go after we know that we've been diagnosed?
Yes. If you're thinking that you're having lymphedema, then you can call our wound care center at 304-285-1460, and we can get you set up with a doctor who will make sure that you are able to receive the treatment. And then once he clears you, then I'll work with you, and we'll make sure that we can get as much of the swelling out as we possibly can.
Are we going to be comfortable with the wraps? Are we going to be able to resume life as we know it?
Yes, it's usually you're in wraps for about 3 weeks, and those 3 weeks are a little uncomfortable because the wraps are so big. and bulky. They're just sort of in the way. But a lot of people say that the first night that they are wrapped, they feel so much better that they don't mind the bulkiness of the wraps. Because their leg feels good and contained, or their arm. And it's only a short amount of time, and then you'll get transitioned to a garment.
So we can shower and do everything with the wraps. What's their life? How long do we have to change them?
You wear the wraps for 24 hours. You take them off to shower. You would put the lotion on, and then you would wrap them right back up. You don't want your limb or your arm or leg to be not contained.
It puts the lotion on. You ever see that movie? It puts the lotion. I think it's Silence of the Lambs. Okay, that's just, I think about things while you're talking. Nonetheless,
what's scary is I do remember that.
Yeah, so you change them every 24 hours. I guess insurance and HMO should cover the cost of this, I would think, because it is a disease, and that's what I'm talking about, the wraps and the bandages and everything.
We provide the bandages to you at Mon General, and it depends on your insurance as what they'll cover in terms of your garments, but it's a very expensive adventure, but there are ways to get around.
So 1% of the population, so there's people among us that are walking around under wraps.
Yes.
Yeah, we wouldn't know it, though, and they're living your normal life. You can do that, but again, It's something you shouldn't ignore. So with the few minutes that we have left, again, maybe we should talk about those 4 stages a little bit more. The first stage is you start to notice a swelling.
Yes, and then from there it'll progress to where you'll start to notice your pant or your sleeve is tighter than it normally is. Your ring will be tight on your hand, and then from there you can elevate it. And if you elevate it and the fluid goes away, you still want to get checked out. But the fluid will keep accumulating to where if you elevate it, it won't go away, and then you notice the skin changes. So the sooner you can come in, the better. It reduces
don't ignore it,
faster.
because if you ignore it, you could be in trouble.
Have a job where you use that arm, I mean, does it aggravate it the more you use it without getting it treated?
If you say you're typing and you have an arm, then we'll put extra padding in near your elbow so that you can bend and it won't really be in your way. And if you need your fingertips, we can leave your fingertips out for typing and things. So I work with you to make sure that you can complete your daily activities.
So if I'm going to dunk basketballs while playing a pickup game or something like that, you'll help me with my arm if it happens to have lymphedema?
Yes.
Okay. Well, that's good to know. So you can go back to living your normal life, which is important to most of us. And we should see our doctor first, though, correct? Because if you get that sign of swelling, you go to your doctor immediately to eliminate certain things, blood clots and other things that could mask it, right?
Yes, you can go to your doctor, or you are able to come to the wound care center and see our doctor who can get you right in.
But a lot of us who are on our feet all day get the swelling in the ankles anyway, right?
Yes.
But what is that? That's just blood getting down there, not all pumping back to your heart, or what?
It could be a number of things. It could be a venous insufficiency. But most of us, if you're on your feet all day, should be wearing some sort of mild compression
We just did a show on venous insufficiency. You remember what that is, Kay?
Sure.
The blood... Okay, I'll tell you. Tell me if I'm right, Greg. The blood goes down to the veins through your legs, and then gets pumped back up. And you got little valves in your vein, and they close when the blood pumps up. You don't want it to go back down between heartbeats, so the valves close and keep it there till it pumps it up again.
Very good.
See, I learned from these shows.
I missed that show.
You were here.
I missed that show.
Oh, yeah. Now that I think about it, yep, you did.
Yeah,
I remember that show. All right. Well, thank you so much, Erin.
Thank you.
Erin.
And again, we can contact our doctor and then contact Mon General Hospital. Maybe your doctor is at Mon General Hospital, and let them know if you start to notice swelling in any of your extremities or body parts, because that could be the first indicator that you have lymphedema. This show is brought to you by Mon General Hospital every Thursday morning at 8:35, and you can view videos of these shows, past topics, at the website mongeneral.com.